this video, I will be going over step-by-step how to manage a postpartum hemorrhage. So in your scenario, you have a patient with some extra bleeding. What you want to do is go ahead and lay the bed flat and start massaging her fundus. Then you would page your resident on the computer right behind you at 55333, stating room number, patient name, and stat hemorrhage. Then you could press the stat assist button. The secretary may page over and ask if everything is okay, if you need anything, and you would let her know that you need some assistance with the postpartum hemorrhage. Once more nurses start to kind of flood in here, you would start delegating tasks. You would delegate one of the nurses to pretty much be your runner. You would have them run to get your scale, which is located in the nursery. These do need to be plugged in, so once you plug it in, you would zero out, and then start weighing anything that's saturated with blood, whether it's the Chuck's pad, or the peri pad, or any of the linen. We don't want you estimating blood loss, so we want accurate results. No eyeballing blood loss. You also have a nurse run and get the Dynamat. You go ahead and put this to the patient, put the cuff on and the pulse ox, and go ahead and cycle it for every 5 minutes. The runner will also get the postpartum hemorrhage kit as well as the postpartum hemorrhage medications, these are both located in the med room. In here are all the supplies that you need to draw blood, start an IV. There's an extra bag of LR, IV tubing, and supplies for your resident. They have sterile gloves and a gown in here. At the top, it also has our postpartum escalation tree, so in case you do forget who to call or what medication is contraindicated in a patient, it's all in here in case you forget. Also want to grab a Foley catheter kit. Reason being is that our patients don't generally feel their bladder when it's full, and if your patient's bladder is palpable, it's probably already pushing against the uterus, which is causing more bleeding. So if your patient's bladder is palpable, go ahead and put the catheter in. Now, if your patient or if your resident doesn't respond within 5 minutes, you can call at 22008. That's the first year resident. If they don't answer their phone, it automatically bounces to second year, third year, fourth year. If they can't respond to the emergency, then you can call the unit attending at 22032. So what you want to do is get an IV access started, and once you do, go ahead and run the LR wide open. You want to get the blood draws going. You want a CBC, a DIC panel, and a type and cross in case this patient does end up needing to get transfused at the end of it. You also want to start drawing up the medication. One medication, like I said earlier, when I showed you earlier in the video, does not pop out in the postpartum hemorrhage kit, so that would be your Dilaudid. You also want to get that drawn up. Our residents are probably going to be doing a manual exam, and it's very painful for our patients, so IV, IM, make sure you've got your Dilaudid ready. Our Methergin and Hemabate are in glass vials, so we have filter needles in our kit. You want to draw those up. Those are always given IM, never through the IV. Now, what I like to do is go ahead and give the medication in the leg, because there's someone probably drawing blood on one side, the other one starting an IV, and then the resident may be doing a manual exam. So I usually like to go for the leg. It's more surface area, it's harder to miss. You also will have a nurse doing the recording, so you might have them ordering the blood, the lab draws, the putting in the blood loss, documenting the medications and when they were given, and just helping out recording everything. You have your nurse that's giving the medications, doing the blood draw, or starting the IV. And then you may be doing massaging the fundus and assisting the resident, whether it's giving them the Cytotec, the lubricant, or just letting them know, giving the patient history and the vitals that's going on. Most postpartum hemorrhages occur or are handled within 15 to 20 minutes. If it hasn't been handled by then, more than likely you'll be pushing your patient down to labor and delivery. The room you'll want to bring them to is prep hold 6, and you want to call their charge nurse, letting them know that you're on the way, and their number is 20807. Let them know that my patient BH is on the way, and we are having a hemorrhage, and I'm with the resident, and we're bringing them down right now. Most hemorrhages, I'd like to say, are handled while they're still in the unit, but sometimes that does happen where we have to bring them back to labor and delivery for extra assistance. And this concludes a portion of our postpartum hemorrhage.